catheter introduced into the radial artery. The connecting tube is actually sodium chloride solution, isotonic one, connected to the force transducer and directly measure the blood pressure. This is one method which is not the issue of this session. The method that you are supposed to take blood pressure is the indirect method. Indirect method itself can be divided into two forms, auscultatory and palpatory. Auscultatory and palpatory. In auscultatory method, you use a stethoscope. It has different parts: diaphragm, bell, and the earpiece. There is an opening in the bell part. If you turn this lever and hear a click sound, the opening may be opened or closed. If it is closed, then the diaphragm is activated. If it is open, the bell will be activated. Who is the inventor of a stethoscope? A French Catholic physician by the name of Laennec. He was a musician. Forget about Laennec. He was a musician. He was walking and watching children playing with a hollow wooden instrument. He noticed that when they scratch one end of the tube, they can actually resonate the sound from one end of the tube. And since he was making his musical instrument, especially a flute, he made a flute just like a hollow tube. At that time, when they wanted to examine the patient, they put their ears over the chest wall and listen to the long sound and hard sound. He had an asthmatic patient, a lady, a very obese lady. And in obese patients, you cannot hear the sound by ear. He put that wooden instrument and the stethoscope So this is palpatory method. In palpatory method, you use a stethoscope. Two parts, diaphragm and bells. Bell is actually used when you want to hear high-pitched sound. Diaphragm for low-pitched sound. This is a stethoscope. It takes actually more than a century till the human can invent a sphygmomanometer. The first that has been invented was a sphygmometer, because before that we cannot measure directly the blood pressure. Using some gadgets, the researchers could measure the pulse pressure. A sphygmo means pulse. A sphygmometer means measuring the pulse pressure, not the blood pressure. The first guy that could manage measuring the blood pressure, as I told you yesterday, was Stephanie Hale in 1735. He put a glass tube inside the carotid artery of a mare and measured the height of the blood that is coming into the tube. This is a method of direct blood measurement. Then you have learned Poiseuille. Haven't you? Who is Poiseuille?
No.
You haven't passed circulation?
No.
No? Okay then. Dr. Karimian will tell you. Poiseuille is very well known researcher in blood pressure measurement and also in circulation. Very well known guy. Most of we have known from circulation is coming from Poiseuille, who was a physician and physicist. In 1628, William Harvey noted that we have circulation. Before that, nobody knows that we have circulation. Even Avicenna, Galen, didn't know. Didn't know that we have circulation. In 1628, so we want to measure the blood pressure. A sphygmomanometer. This is called a sphygmomanometer. A sphygmomanometer can be divided into different forms. This is a mercury one. Uses a column of mercury. There is a valve here which can open. Are you talking about the blood pressure? Come closer. Come here. I want to monitor you. Come closer. See, this is a sphygmomanometer, a mercury one. There is a column of mercury, very precise gadget, but it is actually outdated. Why?
The electrical one.
No. Because mercury is a poisonous fluid. If this column is broken and the mercury is released, that would be poisonous. That is why it is outdated. But still, it can be used for a standardization of the other gadgets. It is very accurate. But since the mercury fluid is poisonous, it is now outdated. So there is a connecting tube. This part is called cuff. Inside the cuff, this is a fabricated cuff. Inside the cuff, if you touch it, you have a sphygmomanometer, touch it. Inside the cuff, there is a rubber part which is called bladder. Which is called bladder. There is inside the cuff, there is a rubber part which is called
The
bladder. When you want to take blood pressure, you should use a proper size cuff. Physically, pressure is the pressure is the force that is applied to the area. If you use a large cuff, then the pressure would be lower than it is. If you use a smaller cuff, then the pressure will be read more than that is real. So a proper size cuff is very important. Now listen. When you want to measure the blood pressure, you should wrap the cuff. If you want to measure the blood pressure, you should wrap the cuff around the elbow. Listen. This is the width of the cuff. The width should cover 2/3 of the length of the elbow. 2/3. And 80% of the circumference. 2/3, 80%.
So like this.
You see? The bladder. See? The bladder, 2/3, 80%. No, the elbow. We are talking the elbow. This is the elbow type sphygmomanometer.
Is this?
2/3, 80%.
Do these go down or up?
Oh, I will discuss it. So you should wrap the cuff over the elbow in such a way that the elbow crease, this is the elbow crease, the cuff should be 1 inch above the elbow crease. 1 inch above, 2.5 centimeters above the elbow crease, in which you can easily find the brachial artery pulse. The brachial artery pulse. Take a look. Now I will show you how to wrap it. Give me your hand. Touch your elbow crease with 3 fingers. See, this is the lateral part, this is the medial part. In the medial part, there is a bump when you touch.
Yes.
There is a bump. This bump is tendons of the biceps muscle. Tendon of the biceps muscle. Beneath this tendon, you can palpate the brachial part. Can you find it? No. The elbow should be in extended form. See? Touch the elbow piece. There is a bump in the medial part. In a small finger. See? There is a bump. This is the biceps tendon. Beneath the biceps tendon, you can find, with 3 fingers, not with the thumb. 3 fingers. See? Can you calculate? Yes? There is a bomb. See? There is a theory in which it says bubble of nitrogen is actually formed and broken, and these broken nitrogen bubbles causes the sound qualification. This is one theory. There are quite a few types of theories in that. Anyway, Korotokov sounds. The first sound that can be heard is equal to systolic blood pressure. When the sound is muffled or cut. When there is no cut, the muffling is equal to diastolic blood pressure. If it is cut, then the cut is equal to diastolic blood pressure. This is called palpatory auscultatory method. In palpatory method, it is just enough to put your fingers over the radial groove. Inflate the cuff, then you will have no pause. Then open or release the valve as soon as you can palpate the pulse. That would be equal to systolic blood pressure. Now you have 5 minutes to practice and then we will continue. So the first sound that can be heard is equal to systolic blood pressure or maximum blood pressure.
Okay. Oh, sorry.
Listen. And if the sound is muffled or caught, then that will be the diastolic blood pressure.
We should drop the cuff, then we should listen to the pulse.
See, if you put the stethoscope over the pulse before occluding the arteries, can you hear any sound?
No.
Why? Because the blood flow in our circulation, most of part of the circulation is a laminar flow. Laminar flow doesn't have any sound. But if you occlude the artery and open it, the flow would be turbulent. The turbulent flow causes a sound. So the laminar flow doesn't have any sound. If you put the stethoscope here, or any part that you have paused, then you cannot hear any sound. But if you occlude the artery and open the releasing valve, then the flow would be turbulent. Turbulent flow does have a sound. So this is one. Then you should practice to close and open. To close and open the cuff. Close and open the releasing valve. With the proper, practice, with the proper velocity. If you open it too fast, you cannot hear. You should open it very slowly. So, you should practice. At the end of the class, you have enough time to practice with the gadget. So, the maximum pressure is systolic. The minimum pressure is diastolic. Normally, 140 over 80 millimeter of mercury is the criteria for the normal pressure. More than 140 for systolic blood pressure is called hypertension. More than 90 would also be hypertension. This is a criteria. This criteria has also been changed. Pre-hypertension, moderate and severe hypertension. This criteria has been changed. In American Heart Association side, this criteria has been brought. So 140 over 80. The difference between systolic and diastolic blood pressure is called pulse pressure. Difference between systolic and diastolic blood pressure is called pulse pressure. In many critical settings, we do not use the systolic or diastolic blood pressure. We use mean arterial pressure because most of our tissue are actually nourished by this amount of pressure, which is called mean arterial. Mean arterial pressure is actually taken from this is a radial pressure curve or aortic pressure curve. Mean arterial pressure is the area under the curve of arterial pressure. Means you should know integral, which is very difficult. But there is a rough estimate for measuring mean arterial pressure. Since most of the cardiac cycle is dedicated to diastole, so if you add 2 diastole plus 1 systole and divided by 3, that would be a rough estimate for mean arterial pressure. Normal mean arterial pressure should be more than 90 millimeter of mercury. 2 times 80, am I right? Cross 120 over 3. Is that correct? Did you get it? Normal mean arterial pressure should be more than 90 millimeter of mercury. This is called mean arterial pressure. 2 diastolic plus 1 systolic over 3 is a rough estimate, not the exact. The exact is the area under the surface of radial pulse curve or ARP pulse curve. This is area under the AUC. This is the exact figure for mean arterial pressure. But this is the rough estimate that is normally used in clinical setting. So, in for example cardiac surgery or thoracic surgeries, we do not use systolic and diastolic blood pressure. We use mean arterial pressure. The difference between systolic and diastolic is called pulse pressure. There are some factors that affect blood pressure. 1. Gender. Blood pressure among women is lower than
Men.
men. Before, why? Estrogen effect. Activity. High activity causes more blood pressure. Some hormones, adrenaline, noradrenaline, cortisol, dopamine, quite a few hormones and mediators you can find that can affect your blood pressure. Age. When we grow older, systolic blood pressure is increased, but diastolic blood pressure is unchanged or even decreased. That is why we have a high pulse pressure when we grow older. Did you get it? When we grow older, systolic blood pressure is increased. Diastolic blood pressure doesn't change or even decreases. And then we will have a high pulse pressure. So, activity. When you are exercising, systolic blood pressure
Increases.
Diastolic blood pressure may be increased or even decreased because the peripheral vascular resistance will be decreased. So, age, gender, physical activity, some hormones, stress can affect your blood pressure. In newborn baby, you do not need to measure diastolic blood pressure. When you want to make or take blood pressure, you should use a proper sized cup. In some situation, for example, in burn, handicapped, we cannot take blood pressure from the elbow. We may use proper sized calf for example, thigh. When you use a thigh calf, you should take the pulse in popliteal area. So you should know how to palpate popliteal pulse. You can also use a calf cuff. No, not the direct method, indirect. You may use the calf cuff. When you use the calf cuff, you should know how to palpate dorsalis pedis and posterior tibialis. I will show you how to palpate those pulses. Posterior tibialis and dorsalis pedis pulses. So, popliteal, in thigh calf, dorsalis pedis and posterior tibialis for calf cuff. So you should know how to palpate the pulses. Now, up to now, we have learned systolic and diastolic blood pressure, mean arterial pressure, the factors that affect blood pressure. And now listen. Who play guitars here? Nobody?
Only once in my life.
Violin? Okay then. See, if you play a string, a string musical instrument like guitar, if you pull the string, if you put a very slow, if you touch slowly a string which is very tight, then as soon as you put a very small touch, then it will vibrate. See, in some situation like arteriosclerosis, there is a difference between atherosclerosis and arteriosclerosis. Atherosclerosis means gathering cholesterol in the wall of the arteries. But arteriosclerosis means a stiffening of the wall of the arteries. A stiffening of the wall of the arteries is just touching a very tight string. So it is very easily vibrated. See what is happening in arteriosclerosis. If I wrap the cuff in arteriosclerosis patient, you may face with this situation. Somewhere you hear a sound, then it will be disappeared. And again, appear and disappear. Suppose that I inflate the cuff, but I did not inflate the cuff properly. Then I will lose the first sound, which is the real systolic blood pressure. So, in arteriosclerosis, if I do not inflate the cuff enough, I will lose the first sound. And then, when you use the auscultatory method, when you are taking the blood pressure, as soon as you hear the sound, that would be systolic blood pressure. As soon as the sound is disappeared, then you will release the releasing valve. In arteriosclerosis, if I inflate it even properly, I will hear the sound, the first sound, that would be the exact systolic blood pressure. But the sound will disappear. This is not the real diastolic blood pressure. We should wait till it appears and disappears again. The second disappearance equals to diastolic blood pressure. So, if you do not use the proper method in arteriosclerosis, you may read systolic blood pressure less than real and diastolic blood pressure more than. This is called auscultatory gap. This is called what? Again? In auscultatory gap, we may read the systolic blood pressure less than normal and diastolic blood pressure more than normal. In order to be free of this error, it is better to inflate the cuff up to 300 millimeter of mercury first. Listen to the sound and put your tip of the fingers to palpate simultaneously when you hear the sound. Because as soon as you can palpate the sound, the pulse, that would be equal to systolic blood pressure. And try to wait till at the end of the pressure inside the cuff to hear the second disappearance, which is equal to diastolic blood pressure. There is a Farsi translated, Farsi edition of an applied physiology pamphlet, in which there is an interesting figure in it. It is said that the hypertension can be seen in 1 out of 5 people above 18 years old. Means in our classroom, 1 out of 5 may be affected by hypertension. This is a very big figure. If it is correct, that would be
MashaAllah. Assalamu alaikum.
that would be a very big figure. You are all Muslims, aren't you? Yes.
We
Have
tried
you
it.
ever read
Because it's funny.
the story of Solomon and Belghis
But please,
from Quran?
yeah.
Must be the case.
And
She's
you
a
know who is Hudhud?
There's a
Who
bird.
is Hudhud? Listen, a bird.
Professor, I don't know the story.
You know the story?
I don't know the story.
The story. So you should read Quran.
Oh,
You should read Quran.
oh yeah.
And
Inshallah.
the story of Solomon and look, the blood pressure is still running. Okay. If you read Solomon and Belghis, or the Queen of Saba, am I correct?
I don't know.
Siba? Shiva, okay. In Farsi, in Quran it is called Saba. Saba. Yeah. When Solomon, peace be upon him, became late, what did Solomon said? Huh? Send someone to find Hudhud. And what did he say based on Quran?
He threatened to kill him. He threatened to kill him.
To kill him. Exactly. He threatened to kill him. Why?
Because he was late.
Because he was late.
Hudhud.
And if he couldn't bring a good excuse,
He would kill him.
then
He'll be
he will
stopped.
be executed.
Oh.
Based on Quran, when you come late, you should be executed.
Oh. Oh, I would be
That's an
executed like.
extremist.
You are Muslim,
I
can't
don't say
you?
that.
Based on Quran. Don't be late.
Oh my god.
That's an extremist.
It's risky.
Okay. Listen.
Oh.
Systolic, diastolic,
I thought you said systolic.
pulse pressure, mean arterial pressure. Pulses. So, 1 out of 5 means 20% of the person, of people above 18 years old may suffer hypertension. During a normal life, the heart beats 300 million times. See, if suppose that we are 18 years old and the heart beats 300 billion times over a normal life, see what is happening to the wall of the arteries when you are suffering from hypertension. Huh? So hypertension doesn't have any signs and symptoms. Doesn't have any signs and symptoms. In a screening test, just like in each office, I mean a medicine office, you will have this sphygmomanometer. Since it is a silent disease and can be very dangerous, so taking it will be executed. Why are you coming late? Is it a good experience? Okay, then no one. Easy.
That was nice.
So,
Jokes.
this is what you should know about the blood pressure. I have actually crossed out the history. What history is very important. Okay then, now heart sound. We have already discussed about the heart sound. The first heart sound is due to the closure or vibration of blood and the ventricular walls when the atrioventricular valve are closed. I mean mitral and tricuspid valve. When they are closed. See, there is no physical touch when the valves are opened or closed. But vibration of blood and the ventricular wall causes the sound. The first heart sound has low pitch and long duration, which is called S1. S1.
Dr. For heart sound, we detect the function, or we measure the function of the valve, right?
Function of the valve, no, we can also hear to the sound.
Yeah, I know. By hearing the sound, we can know if this valve is like.
He's talking. This is your classmate, yes?
Yeah, I mean, by listening for this sound, we can detect if that valve can do the function successfully or not.
Yes.
Right?
Yes. By hearing, I tell you what is the use of hearing. First, let us see what is the characteristics of the sound, and we will see what is the use of it. So, first sound, vibration of the blood and the ventricular walls. Long duration, low pitch. It has two parts. Closure of the mitral valve, closure of the tricuspid valve. The second has low duration, high pitch, closure of semilunar valve, I mean aortic valve and pulmonary valve. Where we can hear to the sound for the aortic valve, second intercostal space at right sternal border. The first rib is beneath
Clavicular.
clavicle. This is the first, second. Right sternal border. Put the stethoscope here and then you can hear closure of the aortic valve. Second sternal border at the left side near the sternum, closure of pulmonary valve. So second, aortic, pulmonary. Fourth, fifth and sixth, over the sternum or to the lateral side, I mean to the left side, is where you can put the stethoscope to hear the closure of tricuspid valve. Fourth, fifth and sixth, over the sternum or to the left side, where the closure valve, I mean the closure valve closure, I mean the tricuspid valve closure can be heard. Fourth, fifth and sixth, over the sternum or to the left side. And closure of the mitral valve, mid-clavicular line at fifth intercostal space on the left side. I mean the apex of the heart. You can hear the closure of the mitral valve. Again, second intercostal space at right sternal border, aorta. Second intercostal space at left sternal border, pulmonary. Fourth, fifth and sixth on the sternum or near the left side, tricuspid, and mid-clavicular line at the fifth intercostal space. On the left side is where we call it apex and can be used for the mitral valve closure. Position actually affects heart sound. If you can see in the clinical setting when a cardiologist wants to hear the heart valve closure, he puts his hand over the head and lean forward the patient. When you lean forward, see, the heart is dangling into the thorax. When you lean forward, the apex actually touch the thorax, and then the sound will be better heard. So if you lean forward, or if you have a left lateral decubitus position, and you put the stethoscope over the fifth intercostal space at the apex, you can easily hear the sound. If you inspire the air into your lungs, the air is actually
Conducts the sound.
it cannot conduct the sound. We are talking about the heart sound. That would be an isolation for the heart sound. In deep expiration, you can easily hear the sounds of the heart. So these are the method that you can hear the heart sound. So normally we have two sounds, first and the second. We can also hear the fourth heart sound if we do have less fat tissue and among newborn baby. What is the fourth heart sound? We have discussed in the classroom. What is the reason for fourth?
Closure of the aorta.
No.
Ventricle, it's the wall of ventricle is small.
No.
New baby. That's why.
No, normal. Fourth heart sound is normal in newborn babies after it's a last semester in pregnant women. Fourth, contraction of the atria at the end of systole. 80% of the total volume is coming without any contraction. But extra 20% is coincident with atrial systole. Atrial systole causes the fourth heart sound, which can be heard or can be recorded.
Only in newborns or in everyone? Only in the newborn.
In newborn can be heard, but in normal guys can be recorded, not heard. Third heart sound, in any circumstances, is abnormal. Third, in any circumstances, is abnormal. Why? Because it actually coming from the failure ventricle, which is semi-filled with blood and extra blood coming into it. Since it cannot completely empty, at the next diastole more blood is remaining to it. Then added blood is adding to it, and it brings the third heart sound. Third heart sound is in any case abnormal, which signifies the left ventricular failure. Question? That's it. Now you have enough time to practice.
How much sound you have total in the heart?
1, 2, 3, 4.
For just this is the normal. For not,
1 and 2 is normal, 3 is abnormal, and 4th can be recorded in normal situation and heard among newborn babies,
just for maybe.
late trimester pregnant women, and athletes who have a high stroke volume heart.
So when you want to have the heart sound, you just head to the first
And the second. And listen, let me give you something else. The first sound has two components. Mitral, the first heart sound has two components. Mitral, tricuspid. Closure of mitral and tricuspid. If you have a deep inspiration, during deep inspiration, the diaphragm comes down. Can you hear me? No? What did I say? And constrict the abdominal vein. More blood coming into the right heart. And then, since more blood is coming to the right heart, then it takes too long to empty. So, the mitral valve closure and tricuspid valve closure has a gap. First, mitral closes, and then the tricuspid valve closes. This is called a split. A split. So during deep inspiration, you may have normal split. Closure of mitral valve and tricuspid valve. But suppose that we have myocardial infarction and there is a block somewhere. If in Purkinje fibers of the left side you have a blockage, then the right ventricle, tricuspid valve, will be closed early on the left, and then you will have an abnormal split. Question. Now you can practice. That's it.
So
Practice takes
doctor, so the second from here. It's empty actually.
Yeah, in my defense, this